Welcome to the deep dive. Today we're tackling something really central to healthcare now. How we actually measure patient satisfaction.
Yeah, it sounds straightforward, right? Are patients happy?
Exactly. But we're going to find out it's way more tangled than that. It connects to, well, everything, treatments, outcomes, even hospital finances.
It really does. And, understanding these metrics, it's kind of a shortcut to getting a real sense of care quality and how patient-centered things actually are.
Right. It's definitely not just about a smiley face on a survey.
Not at all. It ties into real clinical results, the economics of it all.
Okay, so for this deep dive, we've pulled together insights from Dr. Mazen M. Salama. He's an expert in this area, works with CPHQ certification prep, and also from a really thorough guide called Measuring Patient Satisfaction.
Good sources.
Yeah. Our mission here is to basically pull out the absolute key insights, the methods they use, what's new, make it all make sense, and maybe find those aha moments for you.
Sounds good.
All right, so let's start right at the beginning. What is patient satisfaction really?
Okay, fundamentally, it's about how well a patient's expectations line up with what they actually experience during their care.
Expectations versus reality.
Pretty much. And that covers a lot. The medical care itself, sure, but also how services are delivered, how easy it is to get seen, communication, the human interactions with staff. And it's crucial to remember it is subjective. Everyone comes in with different backgrounds, different ideas about what good care looks like.
So it's not purely about, say, whether the surgery was technically perfect.
No, not entirely. And more, we're looking at it through the lens of patient-centered care. The Institute of Medicine really pushed this idea, respecting patient values, their preferences, their needs.
Makes sense.
And this shift means satisfaction scores are now baked into things like value-based care models. So how happy patients are directly impacts how much providers get paid, especially through tools like HCAHPS.
HCAHPS. Okay, definitely putting a pin in that one. We need to circle back. But first, what are the big things, the sort of dimensions that shape how satisfied a patient feels? What are they actually reacting to?
Well, there are several key dimensions. First off, access to care. That's huge.
Like, can you actually get an appointment?
Exactly. Geographical barriers, appointment availability, how long you're stuck in the waiting room. And telehealth is changing this. A 2024 study actually showed it cut primary care wait times by like 30%.
30%. That's massive. Okay, access is one. What else?
Interpersonal relationships. This is all about the quality of interactions, with doctors, nurses, everyone.
A human touch.
Absolutely. Empathy, clear communication. Do you trust them? A 2023 study found satisfaction went up 25% for chronic disease patients when they felt involved in decisions, shared decision-making. It's powerful.
Feeling heard really matters, doesn't it?
It really does. Then there's service quality. This is more the non-clinical stuff.
Like, is the place clean?
Yeah, facility cleanliness, how quick staff are to respond, how smoothly the admin side works. Think about patient navigators, folks who help guide patients. A 2024 study saw dissatisfaction drop 15% in cancer care when navigators were involved.
Wow. Just having a guide makes that much difference. What about the money side?
Oh, cost and transparency are becoming critical. Patients want clear bills, affordable options. We saw a 2025 study showing a 20% jump in satisfaction in outpatient settings just by giving clear cost info upfront.
I can believe that. Cost anxiety is real.
Definitely. And, in today's world, the digital experience is a big one, too.
Patient portals, apps.
Right. How well are they integrated? Is it easy to use? A 2024 article linked a smooth digital journey to a really significant 35% increase in satisfaction.
Okay, those numbers really drive it home. So we know what shapes satisfaction, but why is measuring it so important across the board in healthcare?
Oh, the impact is widespread. Let's start with clinical outcomes.
How does satisfaction affect health?
Well, satisfied patients tend to be more engaged. They stick to their treatment plans better. A 2023 meta-analysis found 40% higher adherence rates for chronic conditions among satisfied patients. That's huge for their health.
40%. That's directly impacting wellness.
Absolutely. Then there's risk management. Dissatisfaction can be a red flag.
For lawsuits.
Yeah. A 2024 study found that about 60% of malpractice suits were tied back to poor communication or service issues. Dissatisfaction doesn't just stay dissatisfaction sometimes.
That's a stark connection.
It is. And for the organization's performance itself, High satisfaction boosts reputation, keeps patients coming back. And like we mentioned, those HCAHPS scores, they directly hit Medicare payments. We're talking potential bonuses up to 2% based on 2025 CMS data. Good experience pays, literally.
So it's good for patients, good for the hospital's health too.
Win-win. And finally, patient feedback is a powerful engine for innovation and improvement.
How so?
Ideas straight from patients have led to real changes. Redesigned discharge processes, for example, cut readmissions by 18% in one report from 2024. Patient insights can really uncover blind spots.
It's clear that getting that feedback is non-negotiable then. How are hospitals and clinics actually doing that? Have the methods changed much?
Yeah, there's been a big shift towards more digital and real-time methods. The old ways are still there, but technology is adding a lot more dynamism to how we capture the patient voice.
Okay, let's dig into those methods. What are the main ways providers collect this feedback?
Well, surveys and questionnaires are still a major tool, but they're getting smarter. We're seeing more adaptive questioning now,
Adaptive, meaning what?
meaning the survey changes based on your answers. If you say you had an issue with communication, the next questions might dig deeper into that, makes them more efficient, more targeted. A 2024 study highlighted this growing sophistication.
Okay, that makes sense. More focused. What else?
Telephone interviews are still common, especially for follow-ups after someone leaves the hospital. And interestingly, using automated systems like IVR, it's actually boosted response rates by about 25%, according to 2025 data.
Really? I'd have thought people would hang up on a robot.
Maybe it's the convenience. You can do it on your own time. Then you have face-to-face interviews. These are great for really deep qualitative insights. You can use guides like the PEIG to structure them a bit.
Right, for getting the story behind the numbers. What about talking to multiple patients at once?
That's where focus groups come in. Small groups, usually diverse, discussing specific topics, really useful for exploring new ideas or understanding shared frustrations. They use specific sampling techniques now to make sure they get the right mix of people.
Like a structured group conversation. And digitally.
Digital communications are exploding. Email, secure messages via portals, even watching social media like X. Sentiment analysis is a newer thing there, using software to gauge the emotional tone in online comments about a hospital or clinic.
Wow, listening in on the public conversation. What about when things go really wrong? Formal complaints.
Exactly. The formal complaint and grievance processes, these are usually mandated by regulators like CMS. And technology is helping here too. Automated tracking systems are cutting resolution times significantly, like by 40%, according to one 2024 report, making the process faster.
So tech helps gather feedback and deal with problems faster. Okay, designing these feedback tools must be tricky. What do you need to consider?
Oh, absolutely critical. For survey design, think about length. Keep it short. Research shows completion rates plummet after maybe 10-15 minutes.
People just give up.
Yeah. Language and literacy, too. Plain language, maybe 6th grade reading level, offer multiple languages, make it accessible. That was stressed in health equity in 2023.
Makes total sense. You want everyone to be able to respond.
Then the response scales. Like Hertz scales, strongly agree-disagree are common. But semantic differentials, poor to excellent, can be clearer sometimes. Timing is also key. Close to the event is better for recall at discharge or within 48 hours. Real-time feedback on apps actually gets about 20% higher response.
Capture it while it's fresh. Digital helps there.
Definitely. And cultural competence. The tools need to respect different backgrounds. Using community input, like CBPR methods, helps make surveys more relevant for everyone. And finally, digital integration, things like making feedback a bit like a game, gamification. That can boost engagement by about 15%.
Lots to think about just to ask a few questions effectively. Okay,
Yeah.
let's zero in on patient satisfaction surveys specifically. What's their main job?
3 main things, really. 1, get a number, a measure of overall satisfaction. 2, pinpoint specific problem areas, where are things going wrong. And 3, get data to drive actual improvements.
Measure, identify, improve. Got it. What makes for a good satisfaction survey question?
Specificity helps. Instead of, were you satisfied, ask about, say, how satisfied were you with the explanation of your medications? Use standardized scales, maybe even Net Promoter Score, NPS, would you recommend us? That lets you benchmark.
Compare yourself to others.
Right. And get a representative sample. Don't just survey one type of patient. Use methods like stratified sampling to get a good cross-section. And finally, promise anonymity. People are often more honest if they know it's confidential.
Specific questions, standard scores, diverse group, privacy. Makes sense. When's the best time to actually give out these surveys?
Several options. At discharge captures immediate feelings, but maybe not the settling in at home part. Post-discharge, usually within 48 hours, is common, especially for HCAHPS. Gives a bit of time for reflection. You can also do them periodically for ongoing care. And like we said, real-time via kiosks or apps often gets better response rates.
Okay, now we have to talk about HCHPS properly. You've mentioned it a few times. What is it exactly?
Right. So CHPS Consumer Assessment of Healthcare Providers and Systems is a whole family of surveys from AHRQ, the Agency for Healthcare Research and Quality. They're basically the gold standard for measuring patient experience.
And HCHPS is the hospital one.
Exactly. Hospital CAHPS. It's got 27 questions covering 9 key areas: communication with nurses, communication with doctors, staff responsiveness, pain management, discharge info, things like
Very
that.
comprehensive.
Yeah, and it's mandatory for hospitals that take Medicare. The results, they get posted publicly on the CMS Care Compare website. So lots of transparency.
High stakes then, being public like that. Is it static or does it get updated?
It evolves. Just in 2025, they added new questions about telehealth and about billing clarity, trying to keep pace with what matters to patients now.
Good. And you said it hits the bottom line, reimbursements.
Big time. HDHPS scores can make up as much as 25% of a hospital's total value-based purchasing score. That VBP score directly impacts their Medicare payments. So yeah, there's a very strong financial incentive to do well on patient experience.
A quarter of the score? Okay, that's significant. Are there downsides or challenges with HCA-HPS?
Yeah, a couple big ones. Response rates tend to be low, like 25–30% on average.
So only a fraction of patients respond.
Right, which makes you wonder how representative the results really are. They're trying things like digital reminders, which help a bit, maybe boost rates 10% or so, but it's still a challenge. The other issue is potential response bias.
Meaning?
People who had a really great experience or a really awful one are often the most motivated to fill out the survey. The folks in the middle, maybe their voices aren't captured as well. It could skew the average.
The extremes might be overrepresented. Important context when looking at those scores. Okay, let's switch from surveys to interviews. What do patient interviews give you that surveys don't?
Interviews give you the why, the qualitative depth. Surveys give you the what's, the scores, the ratings. Interviews let you explore experiences in detail, understand the nuances, the context. You hear it in the patient's own words.
Yet the story behind the score. When are they particularly useful?
Really good for understanding treatment adherence, especially for complex chronic conditions. Why aren't they taking their meds? What are the barriers? Also great for post-discharge experiences. How's managing at home? Did they understand the instructions? And they can uncover unmet needs, maybe around mental health support, that a survey might miss.
So much richer information. What kinds of interviews are there?
You've got structured interviews using a fixed set of questions. The PE guide helps with that. And it was updated in 2024 to include things like telehealth and social needs. Then semi-structured, which is more flexible. You have core questions, but you can probe, follow interesting tangents. Good for exploring unexpected issues. And telephone interviews, common for follow-up, but CMS has rules about when you can call after discharge, especially relative to HCA-HPS, to avoid influencing survey responses.
Right, don't want to bias the official survey. What makes for a good patient interview? Any best practices?
Good interviewer training is key. Active listening, being culturally sensitive, building rapport that's crucial. Timing matters too. Maybe 7 to 14 days post-discharge seems like a sweet spot, enough time to settle, but memory is still relatively fresh. And really important is data integration.
Combining interview insights with survey data.
Exactly, get the full picture. And now, with natural language processing, NLP, we can actually analyze the text from interviews, pull out themes automatically with pretty high accuracy, like 90%.
That's amazing. Tech helps make sense of the stories, too. Okay, what about focus groups? How do they fit in?
Focus groups are about group dynamics. Small groups, maybe 6–10 patients, discussing a specific topic. Great for brainstorming, exploring shared experiences, generating ideas or hypotheses you can test later.
Can you give an example? What kind of topic?
Sure. You might run a focus group with diabetic patients about challenges with insulin pumps, or maybe parents talking about their experiences with pediatric telehealth, or even patients who had a specific surgery talking about their recovery.
Very targeted. How do you set up and run a good focus group?
Participant selection is important. You want the right mix of people relevant to the topic, maybe using purposive sampling. Moderation is vital. You need a skilled facilitator to guide the discussion, make sure everyone contributes, keep it on track. Virtual focus groups are also becoming more common, making it easier for people to participate, potentially boosting access by 20%. And then the analysis, usually thematic analysis, looking for recurring patterns in what people said. Software like NVivo can help manage and analyze the discussion data.
And have focus groups actually led to real changes?
Oh, yeah. There are examples where patient feedback from focus groups led to redesigning discharge instructions, which then cut readmissions by 15%, or developing culturally specific mental health programs that saw engagement jump 30%. Patient ideas making a real difference.
That's powerful stuff. Okay, shifting again, let's talk about complaints and grievances. Often negative feedback, but important. Is there a difference?
Generally, yes. A complaint is often seen as less formal, maybe verbal, something that can hopefully be resolved quickly right there and then, like, my room is cold. A grievance is usually more formal, often written, alleging a more serious issue, maybe about quality of care, patient rights, billing that needs a formal investigation and response following set procedures.
Okay. And there are rules about how hospitals have to handle these.
Definitely. CMS, the Joint Commission, they have requirements. Hospitals need clear, accessible ways for patients to file complaints and grievances in different languages if needed. They have to respond promptly, investigate thoroughly, and communicate back to the patient. And crucially, they have to track this data, analyze it for trends, and use it for quality improvement. It's not just about fixing one problem, it's about system learning.
Learning from mistakes, essentially. Any new developments in managing complaints?
Yeah, digital platforms are making submission and tracking easier and faster, cutting resolution times by maybe 35%. There's also work on predictive analytics, using algorithms to spot patients who might be at risk of complaining, so maybe staff can intervene proactively. And using patient advocates to help patients through the process seems to really improve satisfaction with how complaints are handled by up to 40%.
Making the process less intimidating, more effective, okay,
Right.
related but different. Patient appeals, what are those?
An appeal is specifically when a patient asks the organization or insurer to reconsider a formal decision they made, usually about coverage, denying payment for a treatment, refusing a service, that kind of thing. It's distinct from a grievance, which is more about the experience of care.
Got it. Appeal, challenging a decision. Grievance, unhappy with the experience. What's the appeals process generally look like?
Typically, the patient initiates it, often using standard forms, maybe via a patient portal now. Then there's a review, usually by a panel, could include doctors, administrators, insurance reps. There are often set timelines for this, especially from CMS. And finally, a resolution is decided and communicated clearly, including info on next steps if the patient still disagrees, like external review.
What should organizations do to handle appeals well?
Transparency is key. Make the process clear. Explain the patient's rights. That builds trust. Providing support, like patient navigators to help with the paperwork, can actually increase the chance of a successful appeal by about 25%. And again, using the data. Analyze appeal outcomes. Are lots of people appealing denials for the same thing? Maybe a policy needs review. It's another feedback loop for improvement.
So even appeals data feeds back into making things better. Okay, we've gathered all this feedback surveys, interviews, complaints, appeals. What happens next? How do you analyze it all and turn it into real quality improvements?
There's a whole toolbox for analysis. Basic descriptive statistics averages, percentages give you the overview. Trend analysis lets you see if satisfaction is going up or down over time. Correlation analysis helps link factors like, does reducing wait times actually correlate with higher satisfaction scores? A 2024 study showed it did. And sentiment analysis, using NLP on text comments, helps quantify the feeling behind the feedback with pretty good accuracy, maybe 85%.
Looking at numbers, trends, links, and feelings, how does that analysis spark change?
It feeds directly into quality improvement. Root cause analysis uses the data to dig down why are patients unhappy with, say, discharge planning. Then you can fix the root problem. Benchmarking against national standards like HCAHPS percentiles shows where you stand compared to others, highlighting areas needing focus. And creating continuous feedback loops like real-time dashboards for stat lets teams see feedback quickly and respond, which can actually reduce how many complaints escalate.
So it becomes an active, ongoing process. Are new technologies changing this analysis part too?
For sure. AI is being looked at for predictive models, identifying potential issues before they happen, and for personalizing interventions. Blockchain is being explored for creating super secure, transparent feedback systems. And data from wearables and IoT devices could eventually be integrated, giving a richer, real-time picture of the patient's health and experience combined.
Fascinating. Technology keeps pushing the boundaries. So looking ahead, what are the big future directions for patient satisfaction measurement?
Definitely more personalization and precision. Think tailored feedback tools, AI figuring out the best way to engage each patient. Predictions suggest this could boost satisfaction significantly, maybe 30% by 2030.
Wow. Tailoring the experience and the feedback. What else?
A bigger focus on equity and inclusion, really working to understand and address satisfaction gaps between different groups. That means more culturally sensitive tools, more community engagement. Also, the digital transformation isn't slowing down. More feedback via apps, maybe even things like VR for patient education affecting experience, blockchain for secure feedback. One prediction suggests half of all feedback could be via mobile apps by 2028.
Half. That's a huge shift. What about the rules and regulations?
Expect regulatory evolution, CMS, AHRQ. They'll likely keep expanding what they measure, adding things like social determinants of health, maybe more detailed telehealth metrics. Hospitals will need to stay agile, keep adapting their measurement strategies.
It's definitely a field that's not standing still. Okay, as we wrap up this deep dive, what are the main things you want people to take away?
I think the key things are patient satisfaction isn't simple fluff. It's a complex, critical metric tied to almost everything in healthcare outcomes, risk, finance, innovation. Measuring it well needs multiple methods, solid analysis, and adapting to new tech and rules.
And for you, listening in, we really hope this is giving you a clearer, deeper understanding of why measuring patient satisfaction matters so much and how complex it actually is.
Yeah, and maybe a final thought to leave you with. Think about that balance. We need standardized measures like HCAH, HPS to compare and benchmark. But the future also seems to be about more personalized approaches to really get at individual patient needs and expectations. How do we best blend those two? That's a big question going forward. Definitely worth exploring the research and watching how this space continues to evolve.